I am thrilled to introduce you today to Dr. Maggie Roth. She comes to this work as a pelvic health expert, physical therapist, and living her own experience as a postpartum mom who had tons of experience working with athletes and athletic injuries. And now she specializes in working with women, especially mothers of young children who also deal with chronic pain. If you are a new mom, a mom of elementary school kids, if you're a women's or pelvic health physical therapist, this episode is for you. Hi, and welcome back, everyone, to the Integrative Women's Health Podcast. I'm so excited to introduce you to Maggie Roth. She is one of our Women's Health Coach certification graduates. She comes to us as a physical therapist with a subspecialty in pelvic health. And we are going to get into this conversation about her transformation in work, in life. Welcome, Maggie. Tell us a bit about your background before you began the Women's Health Coach certification.
So I originally went to school for undergraduate for athletic training and continued my studies in physical therapy. And at the time, I was gung ho on ortho, had done a ton of sports, seen all the injuries, experienced some myself. And it's just funny because you were introduced to these different specialties and very narrow minded going into it and didn't really know what more there was out there. And so when I graduated, I had done the, hey, you're seeing everybody every half hour, you're doing ortho, you're working with athletes, elite athletes, high school athletes, and everybody in between. Got more into complex post-operative conditions, which is where I started to see some of the cracks in the system where, hey, we've got people that are getting lumbar fusions or back surgeries, and it's not addressing their pain. They still have the same pain. And that clicked for me. What are we missing? And we could get them 70% better, 80% better, but it's not where they wanted to be or where they expected to be after undergoing such a complex journey for them too. And it's frustrating to see people leave and they're not achieving their goals. That's ultimately why you get into this, is to be a guide to help people achieve their goals. After having kids myself and going through a difficult postpartum journey and realizing that there weren't enough resources, or I was questionable with the resources I had, I delved into pelvic health and really supporting women and people with a female pelvis to really hone in on what more can we do. And that started with pelvic PT slightly before the pandemic. And during that time, I had an opportunity to just reassess where I wanted to be, what was I not answering at the time, and how could I get more information. As a type A person, you come out of school thinking you've got a lot of the answers, and it's been a very humbling journey to realize that there never will be, and there's so much more to learn out there. And so it was a couple of years in the making that I was delving into. I liked the health coaching end of things and just figuring out what program worked for me. I had interviewed a couple different areas. I had reached out to a few different people within the field, Michelle Lyons. I had looked at your website, and then I had interviewed through that process, and it took a little bit of committing, and it was really more of the financial limitation at the time. And finally, I'm like, you know what? I'm going to start my own practice. What can I do more for people? And how can I give this a more holistic, integrative approach to this? And as I started my own practice, I'm like, you know what? It's just time to commit. I'm going in a different direction within my life. And I feel like I can help people a little bit better. And that's when I started the Women's Health Coaching Program.
Yeah. What were some of the features that stood out to you about this program above and beyond others?
It was it and I mean that's your whole approach, and the ethos behind it is the integration. It's
Mm.
not just focusing on functional medicine or the nutrition aspect. It's not just the physical aspect. We are taking multiple components of an individual and really the communication behind it, and recognizing that how I can take myself out of it a little bit more and make it more about someone else's journey, and being able to separate those two while being a coach or being a guide during this too. The amount of time that we had to practice in person, the retreats, extremely beneficial. And for people out there that haven't taken it, there are 3-day courses, 3 times that you are devoting your and dedicating your time to be able to work on this with different individuals and see different aspects and get different feedback, so that you can truly better yourself to be able to help others more to achieve their goals.
Yeah. So within our program, we actually have that hands on, so be in with everyone else in your program, that practice, practice, practice. That's what we hear all the time too. It's like you can learn and intellectually understand coaching, but it's a totally different thing to practice, practice, practice.
Absolutely. And the modules are extremely helpful, and we've are guided throughout the program. Hey, before this first retreat, you may want to complete these modules, so that way you're prepared in the best way possible to help yourself and others that are in the retreat, and give the appropriate feedback and receive the appropriate feedback, so that everybody's benefiting. And I always find it funny, within any field that we're practicing in, just being able to participate and get that repetition is where you're going to stand apart from others, and honestly make it more comfortable for when you actually practice this. Clients can feel that, and you want to make sure that that's ultimately, you want to create that safe space for them, if anything, and yourself. And if that's what I've learned the most from it, that is it.
Yeah, I think that's so powerful because one of the biggest complaints about the conventional health system, but even the sort of like integrative health system, is that there's a lot of gaslighting and lack of safety, and even just where like, here, put this gown on and sit naked in a room for an undeterminate amount of time, like no matter what. It's a very uncomfortable environment for people. So the skill set of coaching actually teaches you to create for your client and also for you. Talk a little bit about how integrating health coaching within your physical therapy practice has made you feel less burnt out.
Absolutely. I feel I have a bigger connection with my patients than I ever have. And that even translates to working with other professionals within the, I don't even want to limit it to the Western medicine paradigm, because just with any professionals that are working with the care team that these individuals have chosen to assist them through their journey too. I had a client not too long ago that we were working on. She was having trouble with intimacy and being able to experience it without fear. And we were able to peel away, I always describe it as like you're peeling away the layers of an onion, and you're really trying to get at the root cause. And I'm able to have 45 minutes with my patients one on one, which is fabulous. And it took an entire 45 minutes to get down to, a few years ago, she had moved her room to make room for a desk. And it was just the matter of changing where her bed was facing to make her feel more comfortable. Other practitioners or professionals don't have that kind of time. It took the 45 minutes. And if you are just going through getting bombarded with questions and not giving space for people to be able to really dig deep, and ask those curious questions or answer them, we would have never figured that out. And it made such a huge jump to where she was and where we were able to go. And then just feel comfortable enough to discuss some of those smaller details was able to jumpstart, I felt like, her journey, her healing journey.
It's not even just the time, it's the skill of listening, it's the skill of knowing what little pieces to pick out and in the story. And those are really the communication tools of coaching. So now, as you're building your coaching practice, have you seen anything about how this will affect your own life, your clients, your ability to be more flexible with your family and friends?
It's been such a rewarding experience going through this certification program and practicing because it's something that is incorporated into every facet of my life. It's how I communicate with my family, my friends, my clients. And when we're defining communication, I feel like we kind of have the narrow-mindedness of it's the talking piece of it. But what we tend to ignore is the listening piece and being able to give that space and realizing that people just have time to dig into their thoughts. And I grew up in a family that there were so many of us, you just talk over each other. And when you're limited with a certain amount of time, even in the clinic, you're like, okay, we've got to speed this up because I've got more questions to ask. When really, in the grand scheme of things, okay, if we can get through this, there's always time to approach it at a later date too, at least for where I'm at professionally. But communicating with my kids, I have a 7 and 5 year old, and sometimes they're having a hard time expressing themselves. They're emotionally trying to regulate and they don't understand the right words. And just being able to give them space, my husband, my partner, when you're having a discussion and being able to just stay curious, stay open. And I'm constantly reassessing where I'm at, usually every couple of weeks. And we've practiced this. It's one of the first things we learn in the course is assessing yourself and knowing where you're at so that way you can be able to help others and kind of almost associate, okay, where am I at? And am I muddling the waters for others too? And okay, this has been better. My perspective's been better this week, but now I really want to work on the physical aspect now that I've worked on that, after I've reassessed it after a few weeks too. So, yes. At the beginning of the program, I struggled with work life balance. And even before that, one of my toughest transitions was after I had my daughter. So I've got 2 kids. And that balance really turned me for a loop. Being able to recognize where I want to put my energy. I am very much, I was like, go, go, go all the time, never had enough rest. And that's where the burnout happens just in life. So being able to take a step back and, what's going to energize me at this moment? Is it sitting back and reading a book? Is it hopping on the bike? We just spent 2 weeks and we were outside the entire time and I've never felt more rejuvenated. And it was a balance of family time, time to myself, and really communicating that with everybody else around me. Hey, I just need a moment, hey, I've got to get laundry done today. And then we can hang out and we can do a bonfire or something like that. Hey, mom's got to do a little bit of work tonight before we go to bed, but then we're going to read some bedtime stories. And just being open about setting boundaries, letting people know my boundaries, but respecting other people's also, again, family, friends, clients. That's where I've really seen the most success.
That's lovely. And so, as you envision now, you're just in the beginning stages of starting your health coaching practice. What's your vision for the next, and I know you're already doing it at some level, but what's the bigger vision for the next year?
I would love to incorporate the coaching within physical therapy, and not necessarily as the same entity, but as an adjunct to it. So being able to have 2 days a week where I am working with coaching clients to be able to, help them along their journey. And specifically, right now, my practice is moving towards mothers, but mothers with managing chronic pain.
Mm.
It integrates both worlds of where I've come in my career, and really niching that to not just all moms. And I'm willing to help anybody that wants that assistance, but recognizing how much chronic pain has affected people, or chronic conditions for that matter, that are really functionally limiting, and just being there as a support system, so that way people aren't alone, and they know that they have it within themselves to get over these humps, to be able to get whatever goals they're looking to strive for.
Yeah, that's so beautiful because I think there's such an integration between your skill set of physical therapy, your experience, but now you've seen as a busy working mom, as you've started to integrate functional nutrition, as you've started to integrate health coaching, communication skills, lifestyle medicine skills, that instead of kind of having people being stuck at that 80% recovery level, some of them are getting all the way there.
And it's fascinating because, again, when we're reassessing, with our clients, whether it's coaching, whether it's physical therapy, whatever entity you're in, we're always thinking, is this enough? Is what I'm doing, is what this patient's doing enough? Are we providing enough resources? Are there other resources that can be part of the care team that we're overlooking? And I think with what we've learned in the health coaching realm is there's endless opportunity to draw more help into it, to be able to meet whatever goal that is. And taking myself out of it is, oh, they've mentioned these types of goals that they want to get at, but when we reassess or we dig deeper, making sure that they understand their goals also, and really honing it down to, okay, is are all these kind of ancillary as what the root cause is, to be able to get at what they ultimately want to achieve.
Yeah, I think that's so important because a lot of times while we set goals in any clinical, circumstance, having that real connection, understanding, and the ability to really measure, like, did you achieve your goal? And are you aware of it? Like, can you say, I achieved that goal? Is something that I think, at least in my clinical training and experience, when I was only practicing physical therapy, it's like we'd hit certain functional goals, but it wasn't always exactly what the client had in mind. Like, walking a certain number of steps, having this amount of energy.
When we go through PT school, you're set with all these outcome measure tools, to help. If we hit this certain number, there's a clinical difference. And it's so set in stone. And yes, there's research base behind it, and we can in it. But what people don't recognize is it's not the all that ends all either. It is another tool in the toolbox. And so sometimes I've had people where they don't necessarily achieve these numbers, but they feel so much better around themselves. And or when people fill those out, I've had so many times where they're like, that doesn't always apply to me. And it's a great starting point. What we don't recognize is that it's a screening tool, but you're not asking the curious questions or the deeper questions to get at what those clients are actually in there for. And sometimes they don't even know what they're in there for. I can't tell you how many times that you're sent and they're like, I was told to come here. You're like, okay,
Right.
well, what are your goals? Let's actually get at a reason you want to be here, or why you went to doc and why they're sending you here, and see if this is the appropriate space for you. And if not, then let's get you someplace that you feel comfortable being too, where you feel like you can succeed.
Yeah. Very, very client centered, which I think is different than what we learn in a truly patriarchal healthcare system. Even if it's more ingrained patriarchy, like it's just the structure of the system. It's not necessarily male versus female. It's just this, the doctor's going to tell you what you're going to do versus a really client centered model, that truly client centered, where they get a lot of say in what they're trying to achieve. So, if you were to be talking to a person listening to this episode who's considering becoming a certified women's health coach, what would be your suggestions for them? Your thoughts?
Simple. As Nike put it, just do it. If there's any hesitation whatsoever, I think for a lot of us that go in and we are just so tunnel visioned with the Western paradigm, and even with any training, it just opens a multitude of keeping you motivated and really shifting to where you can see more progress in your clients, in your patients. If you're feeling stuck, there's always something more to ask. And I think it's lovely because we have such a community too around this. You have the support group of alumni that have gone through the program, that we communicate on a regular basis, or if you have questions. And there's so much support within this community too. I I want to give a heads up to my accountability partner that would practice with me, just outside the retreats. You're constantly practicing and getting feedback. And Stephanie was wonderful during the year and a half. And even afterwards, we would continue to practice or discuss different like scenarios that we would run into, just to continue your if you feel like you've achieved it all, you're not going to get any better. There's always room for improvement. And these give you the tools to continue improving. And the resources you continue to provide to the community, Jessica, has been just fascinating. I'm updating myself daily. If I have a lunch break, you're always reading through something new. And it just creates more questions and just continues that curiosity, which is where we need to be to make our clients better for themselves.
Yeah. And I think if you are working with patients with complex chronic pain, complex chronic illness, and the world is evolving. This is getting more and more challenging to unravel. So we really need to collaborate as a community and get those updated research tools continuously.
Absolutely. And we've all lived through this pandemic at this point. And I know a lot of your focus recently has been on, the long haul COVID effects. And it's only going to continue to present over the next few years. And we just want to make sure that, we focus so much on the physical aspect of what's happening with the individuals that have experienced this, but how can we take a more holistic approach to help them manage this? What support system do they have? or what they still need.
Yeah. And I love that you highlight our community because as professionals and coaches and clinicians, we need that support too. So I've been so grateful to have our alumni stay so actively engaged for many of them for more than a decade.
It's fascinating, and it's just a group of, I don't want to limit it to like-minded people, because again, that puts you in a box. There's so much that people contribute to just thinking outside of that box, but it's a group of individuals that are motivated to see change and make a difference, and really get at the resources that others need that we just may not think about on a regular basis.
Yeah, for sure. So, if anyone is interested in learning more about your practice or connecting with you, where should they reach out?
So the best way to reach me is calling or texting, and that number will be in the show notes. I have been posting on social media at Ribbon PT Wellness. Um, with my boundaries over the summer, I've kind of taken a break from that a little bit, and spent some time with family. But coming up here as the kiddos go back to school, that will be more updated. I am I have a podcast myself. It's called Making It with Maggie, where I discuss a lot of these topics in relation to women taking accountability and just recognizing the power they have within themselves. It's transitioning or transforming from awareness to aware yes, and being able to have that power and recognizing you have that control within yourself with a positive spin on it, so that way you can achieve your goals. Where we go over case studies and we go over some of the difficult topics that we're just seeing on a daily basis, and it doesn't just have to apply to one area in your life. It can apply to multiple areas in your life too.
I love that. So, go follow Maggie's podcast. And when she's ready to keep you updated on social media, we'll make sure her handles are in the. Thank you so much for being here, Maggie. And thank you so much for your positive contributions to our entire IWHI community.
Thank you for having me. I appreciate it.